First time for the STEPS program, but PAHO has been providing technical cooperation to Aruba for the last 40 years. And last year, 2 years ago, we helped with the development of the Non-Communicable Diseases Strategic Plan, and this is one of the major activities coming out of that plan that we wanted to accomplish this year. So we've been providing technical assistance to Aruba in public health, mainly in a number of different areas. First, it was in communicable diseases, and now we're looking at non-communicable diseases, in particular the burden of the disease here on the island, and to look at some of the risk factors that are associated with those diseases.
So, but you guys are doing it in worldwide also?
Yeah, it's a world. We have done the survey. PAHO has done the survey in a number of different countries. But as you know, PAHO is America's arm of WHO, the World Health Organization, and WHO has also done it in other countries outside of the Americas region, outside of the Caribbean.
And if you can compare all the other lands, which one is the most that you've seen that have more problems?
Okay, it's difficult. The Caribbean as a whole has very high rates when it comes down to non-communicable diseases. One of the reasons why we're using this particular approach for the survey is to ensure that we can collect data in a particular way so that we can do comparisons between countries and between regions. It's a little early to say who is or which country is a little bit worse off than others, because all the countries in our Caribbean right now have to tackle the issue of increased rates when it comes on to non-communicable diseases. That's why it's important for us to get the information from the population at this point in time to see where Aruba is. We are also going to be doing the survey in a few other Dutch entities, St. Martin and possibly Curaçao later this year and next year. So after a couple of years, we'll have a better idea as to where everybody falls within the spectrum. But on a whole, Aruba follows a pattern in the Caribbean where we have high rates.
And this program is going to be, you guys going to be doing one times a year or 2 times? Or?
Well, the last time the survey was done in Aruba was 2006. As you can understand, it's a very huge undertaking because it's a population-based survey. Dolores will give you more information on that. But it's a huge undertaking because we have to go out to the households. So we do it technically we're supposed to do it every 5 years, but it takes a little while to pull everything together. With that, I want to thank the Minister and his team, the Minister of Health, Tourism and Health, and his team, because they really work closely with us, the Department of Public Health, and also the Central Bureau of Statistics. We all have been working on this to pull the plan together for the last year and a half. So to get to this point is very important, and then after this is even more important when the interviewers have to go out to collect the data, and then we will do the analysis. Once we get the data and we have done the analysis, the information will help us then to develop more effective policies and interventions for Aruba, specifically for Aruba, but also it would help us with comparing data between Aruba and some of the other countries in the Caribbean.
And I support countries and territories such as Aruba in the development and implementation of different surveys and tools to monitor the status of the health of the population, specifically on non-communicable diseases, namely cancers, cardiovascular diseases, diabetes, and chronic respiratory diseases.
How close do you work with all the doctors and everything with these kinds of technicals to get all the information you guys need?
So the population-based surveys such as STEPS, which is the survey we are launching today, involves trained interviewers that are knocking on people's doors and getting the data from the population themselves, who are talking about what the risk factors they have, the diseases they have, responding to different questions, and also they are taking measurements. We don't have doctors collecting the information, because this is a different expertise that is required to go to people's households and get the information we need for the survey. However, all this data will contribute to producing and designing effective policies and interventions that we will see implemented throughout different levels, including the healthcare facilities.